Well, welcome to Endocrine System. That's what we're going to talk about. It is a huge part of your job as a nurse. Endocrine System is covering a lot of different functions in human body, and that will help you identify signs and symptoms that your patients will present to you, and will help you make diagnosis, okay? And I will use like Cushing's disease or stuff like that, and how that is related to what we talked about. So here we go. Endocrine system, basically our hormonal system, is controlled by hypothalamus, which is part of the brain, that's a deep part of the brain, and what it does is that it will control two different aspects of pituitary gland, anterior and posterior part of it. So once you get hypothalamus involved, you can go to posterior pituitary, posterior lobe, or you can go to anterior pituitary, okay? And then from there, you get to release hormones to activate other glands and then other functions, okay? So from posterior pituitary, we get to pretty much have oxytocin and ADH being released. So that's the focus of your attention. So you're going to focus on two things: oxytocin and antidiuretic hormone, for short ADH, that controls urine output. Okay, so let's find out what we get from these two, and then we move to a little bit more complex anterior side of pituitary gland. So these two will be controlling either as a male or a female. Probably know the role of oxytocin in males or females, or just females. Pretty much just females, because that's a big portion of labor, as you know. So oxytocin is one of the main hormones involved in female's body. So you would be involved in uterine contraction. And then we already know uterus is made of what? Mainly. You got three layers, right? Myometrium, or the smooth muscle aspect that will provide the contraction, and then the goal is to push the baby out, and so on and so forth. So, and if you're a male, same kind of contraction, but this is more towards assisting ejaculation. So that plays a role in males in terms of ejaculation. All right? Now, when you look at antidiuretic hormone, this will target kidneys. To be exact, filtration units called nephrons. So when we say nephrons, you probably remember different aspects of nephrons. You have bolus capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule, collecting ducts and all. So this will target a specialized channel at DCT and collecting duct level. So DCT and collecting duct at that level, there are specialized channels called aquaporin. Okay, so aquaporin channels are targeted and activated, and then what it does, it puts restriction on urine output basically by keeping the water. Okay, so you're promoting water retention basically. And that reduces urine output. So that's what it does. And there are substances that can actually block the effects of ADH, like alcohol. So when individuals receive alcoholic beverages, it blocks ADH. So if there is alcohol involved here, so ADH is blocked, and that means you get to increase urine output. And that leads to what? Dehydration. So we could safely say ADH is designed to keep the body hydrated. So it's present unless you do something to block it. Okay? Now if we move to anterior lobe of pituitary gland, we're going to have a whole bunch of different hormones coming our ways, right? So if I move it here, just to create more room for myself, you get to have thyroid stimulating hormone from anterior pituitary. You get to have luteinizing hormone. You get to have follicular stimulating hormone, FSH, right? We get to have human growth hormone coming from anterior pituitary. We get to have prolactin. Also, very important hormone, adrenocorticotropic hormone, ACTH. So these are the major hormones coming from anterior pituitary. And then let's take a look at what they do and what are the possible effects from that. Okay? Obviously, it's self-explanatory. Thyroid stimulating hormone is going to stimulate thyroid. So that targets thyroid gland. And then you have T3, T4, and calcitonin. And we already know that these are pretty much T3 and T4, they are involved in metabolic activities. So they're geared towards altering so hyperthyroidism, hypothyroidism, in other words, fluctuation that you have in T3 and T4 in your patients will change their metabolic rate, energy, body temperature, sweating, all of these will be altered. So you can detect that in your patients with thyroid problems. And calcitonin gets to control calcium. Okay? So that is when you have excessive calcium in blood, for instance, you have hypercalcemia, okay? That means high level of calcium in blood. What calcitonin does is going to remove it from blood and then put that into our bones. Okay? So it works with hypercalcemia. And then luteinizing hormone and follicular stimulating hormones, these are hormones more towards targeting reproductive organs. Okay? So we get to see more of sex hormones productions being controlled by luteinizing hormone. Although in females it's a little bit more complex because they have menstrual cycles. So in females you get to see the role of luteinizing hormone involving ovulation and menstrual cycles. So it's a little bit different than males, but they have similar properties and functions. And then follicular stimulating hormones that we know they target follicles. In other words, if you're a male or you are a female, you will do, in case of males, you do spermatogenesis. And if you're a female, you do what? Oogenesis. So production of a sperm and production of ovum or egg. Okay? So human growth hormone, from the name you can tell it's involving growth. But how? Because human growth hormone has got two kind of opposite functions depending on what body needs. Okay? So human growth hormone will have insulin-like properties and insulin-like properties. So it can work both ways. So in other words, it can control glycemic index in a way. It can elevate or lower glucose. So in the skeletal muscles and livers, we get to see that once implemented, you know the role of insulin, and I will explain that. Beta pancreatic cells that will produce insulin, it will remove glucose from blood and then put that into our cells. Okay. So this will do what? It's going to reduce glucose levels, right? Just like insulin. Whereas anti-insulin properties, as you can imagine, is different. Okay, so that means it's got the opposite properties, so it's going to increase glucose levels. And what it is that lipolysis is involved. So lipids being, okay, so lysis is the basis for that. We can't convert, as you recall, fat and amino acids into glucose. So we divide it into carbohydrate sources for glucose and non-carbohydrate sources for glucose that are amino acids and proteins. So that would be this right here. Okay? So what's next? What's next is prolactin. Okay? Prolactin, from the name you can kind of guess that, okay, this is lactation. So we're talking about, going to make more room here. So then, obviously, females are involved. And how about males? Can they lactate? Obviously, no. They cannot. But it has some other properties for males. So this would be kind of like lactation, as you know, activation of mammary glands, and then you move on and you produce milk as a female. But in case of males, it does play a role in spermatogenesis, production of the sperm in males. So it does have an influence on that. Okay? Now, a very, I put this last because I need more room because it's got a lot of properties. And that's a great source of NCLEX questions, as you may already know. So this targets a specialized gland, and that's adrenal gland. So the target for ACTH is adrenal gland, right? And adrenal, what makes adrenal gland special is that you have two glands in one, because it's got the cortex and medulla, so you have cortical and medullary aspect of that gland, right? So this will be divided into cortex and medulla. Okay? So when it targets cortex, there are three different zones or three different parts involving the cortical region. Okay? So for that, we get to say, okay, there is mineralocorticoid, and then there is glucocorticoid, and then there is androgens. So androgens is kind of interesting because that's one of my questions when I ask my questions. So gonads or gonadotropin. Okay? So minerals, I'm trying to simplify these. So you're thinking about minerals, you're thinking about glucose, you're thinking about gonads. So three different aspects of cortical part. Okay? So very famous hormone here is aldosterone. Remember, probably? Aldosterone. And you have the stress hormone, as you know, okay, cortisol. And then these will pretty much participate in making estrogen from androgen, so conversion of sex hormones into estrogen. So that's a big deal for females, especially after menopause. So postmenopausal, they have ovaries as the target right here. Ovaries will produce hormones, but postmenopausal, you get to see reduction in estrogen production. That means you're primarily getting it from your adrenal gland. Okay. So you still have a source for it. So most females won't have enough, so they end up with some problems. And in extreme cases, they have to go through hormonal replacement therapy with risk factors, obviously. Okay. So the role of aldosterone is pretty big because this also targets kidneys, right? So aldosterone will target kidneys. To be exact, aldosterone targets also distal convoluted tubule and collecting ducts of nephrons. So by kidneys, we're talking about distal convoluted tubule and collecting ducts. Okay, so what different protein channel is targeted? Because ADH targets aquaporin, aldosterone targets sodium channels. So aldosterone, okay, so aldosterone targets sodium channels. So it promotes sodium reabsorption, okay? And once you need sodium reabsorption, wherever sodium goes, water follows. So that will give us what? Water retention. Okay, that means it can be added, that water can be added to your blood volume, so that increases your blood volume, and that increases your blood pressure as a result of that. Make sense? So if you have Cushing's disease, right? You've heard of that. Dogs get it, humans get it, right? Cushing's disease is, you get, in almost all cases, you get a tumor. So overstimulation of pituitary gland. So if you get a tumor, okay, one of the things that you get to see is overproduction and release of this hormone, right? ACTH. And then we know what that does. Cortisol is going to be increased, and then so that increases glucose level. So you can then see that the glucose level is high, and then you can also see that blood pressure is going up as a result of that, right? Because if you overstimulate pituitary, ACTH is going to be increased in great amounts, and then that follows this pathway, and then you end up promoting that, and guess what? Hypertension. Increases heart rate, all of that, cortisol, glucose goes up, heart rate goes up, pulse goes up, blood pressure goes up. All of these, when you find that in your patient, that's a possibility for Cushing's disease, right? So obviously we have to do CT scan and find out about presence of tumor, there's tumor, there's no tumor, so on and so forth. So that will help you target specifically, what's going on. And then don't forget about this, Angela. So that is epinephrine and norepinephrine, right? What does that do? It will increase your what? Sympathetic activity, right? So works, sympathetic activity, what does that mean? That means what's going on is that you're going to increase your heart rate, right? And then it increases vasoconstriction. And vasoconstriction means that it's going to increase blood pressure. So you're playing with blood pressure through different pathways. The blood pressure could be increased by heart problems, blood vessel diameter changes, and fluctuations in blood volume. Okay? So you always think about those three possibilities for having hypertension or high blood pressure. Okay? So this kind of, we can't go into more details at this point. Just want you to have an overall view of what's going on. And then there are other parts of the body. When we say endocrine system, it's not just glands. There are other parts or other tissues that can release hormones or hormone-like substances to control the body. They are part of endocrine system. For instance, if we go to adrenal gland, inferior to adrenal gland, we have what? Kidneys, right? So kidneys have a lot of functions. Primarily are known for filtration and urine formation. However, they have other properties, hormones. Okay, so involving kidneys, we can see if you have a patient in cardiogenic shock, to be exact, hypovolemic shock. That means they have low blood, loss of blood, right? Will trigger what? It's going to lower your blood volume. And lowering blood volume means your blood pressure is going to drop. If the patient is breathing internally, externally, right? So blood pressure falls. When that happens, it's going to activate kidneys to release renin in response. So from juxtaglomerular cells of kidneys, in response to low blood pressure, we get to release renin. Okay? And then renin will activate angiotensin mechanism. So we call it renin-angiotensin mechanism. So renin does this. Angiotensinogen conversion to angiotensin 1. And then angiotensin 1 is released into blood circulation, and then that takes it to our lungs. So this goes to lungs, and there it gets to be converted to angiotensin 2. So here, angiotensin 1 becomes angiotensin 2 under the influence of ACE, angiotensin converting enzyme. So once you get angiotensin 2, right? Angiotensin 2, I'm going to put it up here so you can see better. So once you get angiotensin 2, this will target adrenal gland to release aldosterone as well. And we know what happens to aldosterone. And also, it promotes activation of sympathetic pathway. And then that leads to vasoconstriction. That leads to increased blood pressure. So although kidneys are not known as glands, but they have hormonal properties. They can respond to fluctuations in the body. So in pharmacology, for instance, you will see that we give ACE inhibitors as hypertensive medication to lower blood pressure. Now you know why. Because by inhibiting activities of ACE, you don't get to convert angiotensin 1 to angiotensin 2, and you don't get to increase blood pressure. Okay? So what else do you get in terms of hormones from kidneys? Erythropoietin. Very good. So when you have hypoxia or low level of oxygen in patients, what it does is that it activates the release of erythropoietin from kidneys. And then what it does is that it's going to increase erythropoiesis, or production of red blood cells in bone marrow. So if you do the blood work, you will see that number of red blood cells are